will be getting compressed as well. For anyone with piriformis syndrome, your treatment plan could be to start in the lower back and work your way down, or it could be to start in and around the ankle and work your way up. For me, purely my own way of treating, I like to do back, lumbar spine, hips, and then work down through the hamstrings. I feel that that gives you the most impact for your buck. And if you started at the calves, you wouldn't really associate the calf pain with the sciatic pain and the piriformis. So I wouldn't be starting this end and working up, but it's not wrong, because if they're getting pain radiating down, sometimes it can be quite nice to start that position as well and go into the plantar fascia. So there are lots of different ways that you can do your treatment, but let's start in and around the hips, and then we can layer up the spine on Thursday into it as well.
Do we have to do that in a side lie?
Side lie would work as well. Now, for me, side lie is harder, but you can try both.
Because of the elbow position.
It's the elbow position. So if I show you, you guys are all now going to be obscured by me. So if you go into a side lie position.
Oh my lord.
Knees up into slight flexion, trochanter, PSIS, there to there, halfway between the two. So it's in this kind of angle, this area here. It looks like it's higher, but that's it there. It's just strumming across my finger in that point there. So then my pressure is pushing forwards, and I have to stabilise Craig so that I don't push him forwards all the time, and it becomes this really uncomfortable kind of battle that goes on. When I do it in the side lie, I'm pushing at an angle, I hold on to the trochanter, and then I'm looking for that tight spot. Are we getting to it?
There.
There. Right. So you can tell I'm less confident in the side lie position, but it can be really good, you know, as well. And you can do then lifting your knee up towards me, which innervates the muscle, and then just slowly let the leg drop down. There we go. Yeah, so it's not as intense in that position. It might just be as effective, but for me, the positioning of it it's more labour intensive for the therapist, I feel, and less comfortable in terms of stability and support for your client in that position. You're pushing them forwards as you're doing stuff, but people can't lie on their backs because they've got severe back pain for the piriformis, then this would be your go-to, your next position to go to, and that happens.
Would there bolster them up from underneath so that they can lie?
Yeah, you could do. Yeah. So I have someone that I bolster, put a towel underneath them, and that takes the radiating pain out of their lower back. Yeah. So bolstering would help, but sometimes when you have that radiating pain when you lie face down, then they're not confident to be lying face down, and forcing them to lie down but putting a bolster under them, they can feel a little bit on edge. So you want to try and get them in as much comfort as they can, and that they are feeling liberated to move around and do things, because movement is so important for the spine. But yeah, it does help. Yeah, it does help, definitely. Cool. Any questions? All right.